You've probably heard the name Saxenda Monjaro injections. They turned out to be very trendy in the last few months. Many people are using it as fashion because it makes thick people thin, and celebrities have used it. It was originally made for diabetic patients. Do you know what causes diabetes? What is diabetes? All of this, inshallah, will be discussed throughout this video. Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will talk about diabetes. What is diabetes? Diabetes is the second most disease in the world that people have been affected by it. To understand the diabetes in more detail, we first have to understand what is insulin. Let's say I drank something, maybe this tea. Now, what happened to this tea in my stomach? It basically entered to my stomach and reached to its simplest form, the glucose. The glucose entered to my blood and the blood sugar increases. Now we have a part in our body known as pancreas. What it does, it secretes a hormone called insulin. The insulin goes to each cell of your body and binds with a specific receptor. You can imagine that insulin and the cell have married, so they bind together in order to take that sugar from your blood into the cells so they can make you energy. The sugar can be either converted into energy or stored as fat in your body, or it can be turned into glucagon. That's it. That's the fundamental picture of insulin. Now let's see what is diabetes. In diabetes type 1, your immune system for some reasons attacks the pancreas, specifically the cells which make the insulin, beta cells, which stops the creation of insulin. No insulin means higher levels of sugar in blood. So what happened now? Now we have a human that cannot make insulin. He is now a diabetes patient. So now the sugar is not entering to the cells. It cannot make energy from mitochondria. Big problem. So now what does the doctors do in this case? The doctors give medications. They inject the insulin injection to that patient in order to make insulin from the body, so they take regular injections, and there are other medications like diet, exercise, and other things. Now diabetes type 2 is distinguished for its resistance. What happens in diabetes type 2? The body naturally manufactures the insulin, but for some reason, some of your cells and tissues do not receive that insulin, which means blood sugar level is high, because the insulin is what turns that sugar into energy. It is not reaching to the cells. Now we can conclude that the body cannot make any energy, the body cannot make any glucagon, no fats. So what happens with the sugar? At this point, the pancreas is stimulated that you have to make the insulin. And it actually creates the insulin and keeps on creating. The cycle continues, but it's not reaching to the cells. So the blood sugar rate is still high, and the glucose manufacturing is also reaching that demand, but it's not reaching to that cells. And this cycle keeps on repeating itself. You have got resistance against the insulin, and even some people experience the beta cell failure. They stop producing insulin. All the problem lies here. The diabetes type 2 patients check their sugar levels regularly. They take their exercises and diet in order to control their sugar levels in the blood. In contrast, I want to say, if you or any of your relatives is affected by any disease, be it diabetes or something else, I ask Allah for you the cure. And remember, at this time, your patience and seeking the forgiveness of Allah will take you to higher levels in the paradise. Inshallah, in the akhirah you will be in higher levels. Remember, inna ma'al usri yusra, and Allah subhanahu wa ta'ala said, وَبَشِّرِ الصَّابِرِينَ. Does this mean that you don't take your cure? That's wrong. Because the Prophet ﷺ said, seek treatment, O servants of Allah, for Allah has not created a disease except that He has created its cure. And until here, we say, Subhanakallahumma bihamdik, ashhadu an la ilaha illa ant, astaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh.